let's look at the bones of the internal view of the skull. So again, we have removed our calvarium, our skull cap, so we can see inside of the skull where the brain actually sits. And something that you should pay attention to, even though it may be a little bit hard to see on a video or on a flat piece of paper, is that the brain, of course, is three-dimensional, so the skull has distinctive depressions where different portions of the brain sit. So here's the anterior side of our skull, here's posterior. We have the anterior cranial fossa, a little depression where the frontal lobe of the brain sits. We have the middle cranial fossa where the temporal lobe of the brain sits on the left and right side. And then our posterior cranial fossa, you can see a little indentation here. This is where the cerebellum sits. And superior to that, our occipital lobe of the brain. So if we're thinking about bones, from the internal perspective, we see a little bit of a different view from the inferior side. So on the internal view, the anterior most bone that you see on the left and right is our frontal bone. Now remember, there's just one frontal bone, but in the middle of it, there's a little space where that bone that sort of makes up our nose and nasal cavity, the ethmoid bone, sits. So this area is the ethmoid bone. So frontal, ethmoid. As we work our way posterior, we start to see our sphenoid bone. So this little posterior shelf here, this is part of our sphenoid as well as part of the middle cranial fossa here. So sphenoid, and this little depression is where our pituitary gland lives. It's a little saddle-looking structure as a part of our sphenoid bone. We can see our temporal bones, so you can kind of see a little suture here. This is called the petrous ridge of the temporal bone. Petrous means like it's a rock. It's very, very hard. This is basically where our internal ear structures are located, inside this portion of the bone. And the petrous ridge separates the middle and posterior cranial fossa from each other. And again, part of the temporal bone. And of course, if we look posteriorly, our main bone there is the occipital.